Welcome to NLTV of Manlagawas. Aji September 17 day, Swasth Nari Sashakt Parivaar Abhiyaan health campaign with service for women and children nimite karni ide national level lado Prime Minister Narendra Modi ba launch korlaise aru district level lado Dr. Tino Jongshi-chang Deputy Commissioner Dimapur ba launch korlaise ide district hospital Dimapur Chapel Hall de aru itlo opore alag state capital Kohima ba bi tahan ido video conferencing ba tahan ido launch korlaise to man itlo opore details ba sai sawai
campaign Swasth Nari Sashakt Parivaar Abhiyaan from 17th of September to 2nd October 2025, which will culminate on Gandhi Jayanti on 2nd October. The campaign will be undertaken in close convergence with the Poshan Ma being observed by the Ministry of Women and Child Development. The campaign at the national level has been inaugurated by Honorable Prime Minister Shri Narendra Modi ji at Dhar, Madhya Pradesh, we have just witnessed. The campaign focuses on health and nutrition of women, adolescent girls and the children, aiming to provide essential health services, early detection, prevention, and further empower women and families to adopt lifestyle changes for stronger India. Swasth Nari Sashakt Parivaar Abhiyaan will be organized at Ayushman Arogya Mandirs, the health and wellness centers, the PSCs, CSCs, and the district hospitals, with focus approach to address the specific healthcare needs of women and children. There will be around 1,005 camps will be organized during this period, and at all the PSC, CSC, there will be one day where all the specialist services will be given. But the camp will be there for the whole period. But one day we will inform everyone in advance, and that we have specialist services at that time.
My esteemed honorable colleagues, Mr. Parivaar, Minister in charge of Health and Family Welfare, and colleagues, principal, educated children, and respected Mr. Anand Kilchi, Commissioner Secretary of Health and Family Welfare, our respected Reverend Ezekiel Derek, State Chaplain, our senior officers, and officers from all the departments, our respected Sri Rajendra Singh, State Secretary, representing the Ministry of Health and Family Welfare from India. Friends, ladies and gentlemen, it gives me a great pleasure to be here today to launch our part in the stage, this Swasth Nari Sashakt Parivaar Abhiyaan, a nationwide campaign with the inspiration theme, healthy women, empowered families. Before I go into our topic, today is also a moment of joy and celebration for all of us, as it marks the birthday of our Honorable Prime Minister, Sri Narendra Modi ji. On this special day, on my own behalf and on behalf of the state, join the entire nation in extending our warmest greeting and best wishes to him. May he continue to guide our nation with his visionary leader as we celebrate this occasion. Let us also renew our commitment to realize the dream of the Honorable Prime Minister, a vision of Viksit Bharat 2047. To transform India into a developed nation by the time we mark 100 years of Indian independence. I also wish to place on record my sincere appreciation to this meaningful initiative. Swasth Nari, Sashakt, Parivaar, Abhiyaan, which is aimed at improving women's health and in turn empower families and our community across the nation. Health and empowerment of women are central to the progress of family, community, and the nation at large. When women are healthy, educated, and empowered, the entire society benefits. This campaign being organized from 17 September to 2nd October 2025. Combination on Gandhi Jayanti is a timely and significant initiative of the Ministry of Health and Family Welfare. As we heard, launching by Honorable Prime Minister, we heard him, but most of us, we did not understand. This campaign will focus on health and nutrition of women, adults and girls, and the children with the aim to strengthen early detection and treatment linkage of various diseases. They deliver essential health services to the last mile, promote awareness and encourage families to adopt healthy lifestyle. Across India, this campaign is being organized at health and wellness centers in all the centers of healthcare with a focused approach to address the specific healthcare needs of particularly women and children. Nagaland, the campaign will be conducted, I believe as mentioned, in 522 health units, including 12 district hospitals, 26 CSC, and 18 new PHC, and 97 SWC, PSC, 333 HWC, NSC, and 49 Ayush HWCs. During the campaign fortnight, health camps will provide a comprehensive package of special health services, including screening for non-communicable diseases such as high blood pressure, diabetes, and cancer. Reproduce and child health services including ANC, PNC, immunization, counseling and anemia screening, nutrition, menstrual hygiene awareness, hemoglobin testing, and IFA calcium supplementation, tuberculosis screening and referrals, enrollment of Niksha Mitra and counseling, mental health awareness and counseling. I'm happy to note that Nagaland Institute of Medical Science and Research, NIMSR, will be actively involved in providing specialist services during the health camp in the state. I also appreciate the participation of private hospitals and clinics whose contribution will help extend the reach of this Abhiyaan to more people. I also want to request our elected members to fully involve and supervise these campaigns so that everybody gets the opportunity. And that request goes to our civil societies and the churches, which will be very important. This campaign is an important step towards the vision of healthy, empowered, and Viksit Bharat by 2047. I urge all citizens, especially women, mothers, and young girls, to take full advantage of these services being offered. Let us work towards and together to build healthier families and a stronger Nagaland. I extend my heartiest appreciation to all the doctors, nurses, ushers, Angawati workers, and community volunteers who are the backbone of this campaign. Your dedications and services will make this initiative a difference and a grand success. Let us rededicate ourselves to the goal of universal health coverage and ensure that no one is left behind in our common journey towards the healthier and more prosperous future. I wish this Swasth, Nari, Sashakt, Parivaar Abhiyaan a great success in our state. Thank you and Jai Hind.
To welcome our speaker, the Honorable Deputy Commissioner of Timor, Sri Dr. Kenuchoshi Jang. I also take this privilege to extend a warm welcome to our respected dignitaries, Sri Dr. Yetubi Toko, Chief Medical.
Gracious God, we thank you for this afternoon. At this very moment, we come before your throne of grace and mercy with humble hearts. Loving God, we thank you for giving us the opportunity to gather here today.
Extend my warmest greetings, and today, as we celebrate this launching program of Swasth Nari, Sashakt Parivaar Abhiyaan, that is health camping with services for women and children, we would like to remind you that, like everyone, starting from the Prime Ministers and Chief Ministers said, like India, the present government has a vision for Viksit Bharat, that is develop India by 2047. That is when the 100 years of our independence. So different departments and different organizations has been launching different kind of programs, activities, so that all the activities should be saturated by before the centenary is celebrated. So I think in line with that, even now the government of India has launched this, because we all know the health is one of the most important sector where if you want to be a developed India, because the health sector is one of the most important things. So that's why I think we are more focusing on this health sector, and also like to say that because see, especially women and children, if we are not taking care of their health, we may not be able to achieve the developed India, because we all know, like we know, antenatal care, postnatal care, all these things are required. And today, if we look, Dimapur is one of the main district, I would say. If we start good things from here, definitely it will spread to other district and other remote areas. So I always, like whenever I stand here, I always say that like Dimapur is the main center where all these activities start. So like those health workers, doctors, nurses, ASHA workers, or those in the fields, I would like to request you kindly dedicate yourself. I know you are all doing a good job. It doesn't mean that you are not doing, but still we have to dedicate ourselves. And as this program is being launched, starting from today till 2nd October, in collaboration again from the Social Welfare Department, we have already launched Abhiyaan, Pushan Ma, which will be almost till the mid of October. So in collaboration with all these things, I think if we reach out to the villages, if we reach out to the grassroots levels, I think definitely people will come to understand, and all these people in the grassroots level will be benefited. I know there are many benefits or programs being launched for the benefit of women and children from different sectors, but it is not filtered to the grassroots level. And I see when we went to the villages and when we inquire, many people, villagers, they don't know the programs. And it is us who have learned today and who have heard from the sources. We have to disseminate this information to the villagers, and definitely they will come forward. And I think the target which has been set for us by the ministry and also by the department will be able to achieve together. And I promise that district administration are always behind you, and definitely whenever you need our assistance, we will always be 100% there for you. So kindly, let's all dedicate ourselves and try to work, and during this period which the time frame has given, we'll try to achieve something together for the benefit of our people. So with these few words, I conclude my speech and launch this SNSPCA DA today for Dimapur district.
We are thankful that she has come forward and she has done a wonderful job. At the very outset, first of
Nagaland TV, Sob Manulaga Awas. Watch us live on Geo TV and on your television sets as well. For Dimapur viewers, we are on channel number 994 in Global Chapter, and Kohima and Mokokchung viewers, switch to channel number 138 on Hornbill Digital. For all news and updates, follow us on Facebook, Instagram, YouTube and Twitter.